Hi, everyone. Welcome to tonight's headache school session. My name is Taylor. I am a licensed clinical social worker who works in the University of Utah Behavioral Health Integration Program, specifically in the neurology department. We're going to talk a little bit about cognitive behavioral therapy and how it can be a really useful tool in managing pain and chronic pain generally, and how you can use it specifically. It's a really wide and varied topic. Unfortunately, we won't have enough time to go into it in depth, but at the end of my presentation, do provide some information for if you're interested and can in continuing your education about it and you'd like to meet with me separately, there's ways to do that, absolutely. So I'm going to go ahead and start sharing my screen here. Okay. Like I said, I work for the University of Utah in the neurology department, and my primary role in clinic is to work with patients to help manage kind of the emotional and mental health symptoms that often come along with their neurological condition or their physical symptoms. We know that the body is not just the body and the brain, but it's kind of two things mixed into one. And we treat those two pieces of our body as an integrated unit and not just separate. So oftentimes when we're experiencing chronic pain and when we're experiencing neurological conditions, we have emotional symptoms that are associated, and that's kind of what I help to treat. I do therapy, I do cognitive behavioral therapy, and a number of other modalities that can be effective in helping manage some of that stuff. So just to start out, one of the big reasons why CBT or cognitive behavioral therapy works well for treating pain is that there is a relationship between pain and stress, and that pain is often worsened by stressful situations and by controllable situations. We often feel that pain is sometimes out of our control entirely, and to some extent it absolutely is. Certainly don't want to invalidate those who experience chronic pain. It is a very real, problematic and difficult thing to address. However, there are definitely ways that we can do it and ways that have been shown to be efficacious in treating it. We know, for example, that pain creates stress and stress makes pain worse. So this is kind of the stress, pain, anxiety cycle. As I explain it to patients that I meet with, when you experience pain or you feel something painful, it causes you to feel more stressed out, feel more anxiety, which often worsens your pain symptoms, and then worsens your anxiety, and then worsens your pain symptoms. And so this cycle that we find ourselves in is one of the ways that we can target and treat pain using cognitive behavioral therapy. We can cope with stress in healthier ways, and doing so can help improve pain and pain symptoms. CBT or cognitive behavioral therapy specifically, when we use it to address pain and when we use it to address chronic pain, the whole idea is to identify that cycle, identify the things that contribute to that cycle, the emotional and emotional, cognitive, physical stressors and associated triggers, and then kind of interrupt them or put a little marker in that cycle. If you can imagine just a circle and it's kind of going around and around, if we can put a stop in it, that can often be effective in at least helping to improve pain and chronic pain. CBT is an extremely well-researched and highly efficacious type of therapy. It's very evidence-based. It's been shown to be one of the most effective types of talk therapy. Initially was used and still is obviously used to treat symptoms of depression, anxiety, a myriad of other mental health conditions, other emotional coping conditions, mood disorders, etc. Since kind of its inception and regular use, derivatives, different types of CBT have been adapted. And there are now a number of different types of specific CBT modalities that have been shown to effectively help manage chronic pain, trauma, insomnia, a a variety of other physical and psychological conditions. And we have seen all of these conditions improve, if not be in some ways significantly altered for the better by the use of consistent CBT. It's like I mentioned, CBT for chronic pain is a derivative of CBT that has been shown to be very effective in addressing and lessening and managing chronic pain. And I'll kind of explain a little bit about how this is done, but primarily by addressing kind of our thoughts around pain and our experiences around pain, and by addressing our experiences with what's called the stress response cycle. This is just a little image to kind of give you an idea or to illustrate how CBT works. The best way to describe it is if something happens to you or a situation occurs, we automatically develop thoughts around that situation, be those thoughts being good, bad, neutral, negative, positive, whatever they may be. If you miss a red light or you miss a green light and you are late for work, that situation is going to elicit some sort of thought, and it's likely going to be, a negative or frustrated thought. And usually that thought is what elicits a feeling or an emotion, and that feeling or emotion elicits kind of our reaction or our behavior, which reinforces that thought. So, oftentimes we're so busy and we're so stressed and moving from one thing to the next that we don't necessarily notice that those three things are actually very separate. They happen so quickly and happen so rapidly together that we often kind of mix them together as one idea, but they actually are separate entities. And so CBT addresses that. It kind of picks them apart. We see that, right, like the thought occurs first, which creates the feeling, which creates the behavior, which reinforces the thought. How CBT works with chronic pain is usually, not always, but often the situation where we start to experience pain or start to experience chronic pain is a situation that causes certain thoughts, right? You start to feel a headache or a migraine come on. You have thoughts of frustration, fear, stress, negativity, all those things pop up, which then create emotions and often will influence behavior. And that cycle kind of goes round and round. So how we use CBT to treat chronic pain is we start to identify what specifically those thoughts and feelings and behaviors are, and we kind of rewrite them. And we once we rewrite them, we kind of retrain the brain to think or to respond differently to painful and stressful situations. And we use those changes to approach the situation differently and to change our experience with the stress response cycle. And I'll talk a little bit about what that is. But the idea is thoughts and stressors that are related to pain can be changed or altered, even if they're just subtly changed or altered, and improve our experience of chronic pain. And thus, if we return back to the original kind of pain and stress cycle, improving our experience with chronic pain, therefore, also improves the pain itself. It's not just a mind game, if you will. It's not just a quote unquote, it's all in your head. It truly does actually impact the level and intensity of the pain and the symptoms associated with the pain. So one of the first things that I have patients do when I meet with them is this kind of really basic CBT for pain activity. And it starts out by you just making a list of things that you find stressful or common stressors or triggers in your life. These can be related to your headaches or your chronic pain, or they can be unrelated. It doesn't matter. Often I'll have patients make a long list of everything, and then I'll have them separate it into two categories. Some that are specifically related to the pain and some that are just more generalized or related to something else. And even just making that list itself can actually be a really helpful emotional intervention, because sometimes we just feel so overwhelmed by everything going on that we don't even know what is actually causing our stress or what's actually triggering some of the stress response. Then I'll usually have my patients pick one thing from the list, and we'll kind of do an imagery exercise or activity where we talk about how does that particular item or event make your body feel. I mean, and if you can envision yourself having that event, What does it feel like? Do you feel it in your body? Do you feel it in your chest, in your shoulders, in your head, in your back? Where are you carrying that? What does that typically feel like to you? What does it make you do? How does it make you act? If you can feel a migraine coming on, what's your typical response? Is it to kind of tighten up and to get really stressed out and to feel panicked about, kind of what to do next? Or do you feel like, okay, I'm going to take some, I'm going to take some deep breaths. I feel totally fine. More likely it's the former, and rarely it's the latter. Nobody wants to experience chronic pain, and so our ways of coping with it naturally, without any sort of intervention, tend to not be the most healthy ways to cope. And then what does the event or the trigger make you think? What are the narratives that start to spin around in your mind after you kind of experience that initial trigger? Oftentimes they're really negative, and like a snowball of negative thoughts, like, oh no, like I have no idea how long this is going to last. I might not be able to go to work tomorrow. I'm going to get fired. I'm not going to be able to pay rent or pay my mortgage, et cetera, et cetera. And it can get really out of control really quickly. Um, and then once we kind of do that imagery exercise, we start to work on rewriting that narrative, or changing the way we approach that situation from a negative to kind of a positive or neutral response. So it's very generalized. I cannot cope with this. I'm not going to be able to go to work. I'm going to get fired. I'm not going to be able to pay my rent. To something more simple. Let's just take it one step at a time. I'm going to do some deep breathing. I'm going to relax. I have no idea what's going to happen next. Let's just and just kind of rewriting that experience. And that's a very generalized approach to it. Obviously, when I'm working with patients, there's a lot more individualization, and we can kind of really specifically rewrite those types of thoughts. But that's kind of a general idea. And so you can do this at home. You can practice listing out all of those stressors and activities that cause and that kind of trigger stressful reactions. And you can even just noticing those can be helpful, like I mentioned. And then you can actually practice rewriting. A good specific example from just my own personal life. I like plants, and it was one day I realized I hadn't watered my plants in a week or two, something like that. And my immediate response was just to be so stressed out. It's like, oh my gosh, I haven't watered my plants. I'm so bad at taking care of my plants. They're all going to die. The rewriting of that thought would be to recognize first that I had this very stressful reaction to it. And then rewriting it would be, I'm going to water my plants. That's a neutral response. It's not negative or positive. The positive response would be, wow, this is great that I happen to remember to water my plants right now, and I'm going to do that. That's just kind of a silly example of how that kind of looks, practically speaking. Really quickly, I'm just going to go over what we call the stress response cycle. This is something that we experience day in and day out in our regular lives, all the time, and not something we have a lot of knowledge about. So it's essentially the physiological, the emotional cycle that occurs in our bodies when we encounter a stressful event or situation. And there's kind of the three components to it. A physical component is, what actually happens in our physical body when we encounter something stressful, when we start to feel pain. Maybe our blood pressure increases, our muscles tighten up, we produce more stress hormones, we have decreased immune effectiveness. And as you can imagine, all of these things, physically speaking, are the opposite of what our providers, our neurological providers, tell us to do, or tell us. Often these are the things that make headaches and chronic pain worse. And so, that's the opposite of helpful. We have an emotional component to the stress response cycle, which is our, just our emotional reaction. Usually it's anger, shame, embarrassment, fear, maybe like, how long is this going to go on? Nervousness, what's going to happen next? Frustration, etc. And then there's the cognitive component, which often just includes, difficulty making decisions or having some cognitive impairment. You've noticed probably when you experience chronic pain or any sort of intense pain that there's some confusion or brain fog. And that's, another component of the stress response cycle. The important thing to remember is that stress has an evolutionary biological purpose. If we're hiking in the woods and we run into a bear, that flight or flight response, that adrenaline spike, is actually what ends up saving our lives. In the past, before I like to call them ancestral stressors, we were using the stress response cycle all the time to stay alive. Of course, now that's not really our experience. And so it's problematic, when we have the stress, when we enter the stress response cycle as frequently as we do. And then the final thing that's important to note about it is that you can't just remove the stressor and exit the stress response cycle. If you're hiking in the woods and a bear is chasing after you, and a hunter comes out of nowhere and shoots the bear, you don't automatically immediately feel better, right? Like oftentimes it takes a long time to come down from that stressful experience. The problem is the stressors we experience now are a lot more subtle than running into a bear while we're hiking. And so we often don't realize whether we're still in the stress response cycle or not. And simply removing it, like I say, isn't enough. So these are some really helpful ways that research has indicated can help us actually exit and complete the stress response cycle. Body movement, I specifically chose movement rather than exercise. I think exercise is often something that stresses us out more than less. And this can look like anything. This can look like stretching or dancing or just walking. It doesn't need to be rigorous exercise, just moving your body in some way. Diaphragmatic breathing, talking, having a conversation, connecting with a loved one, laughing, crying. One thing that we're really good at is trying to hold in our tears and not cry. It's embarrassing, or we don't want people to know. That's the opposite of helpful when we're trying to complete the stress response cycle. And some sort of creative expression. There's lots of different ways to do that. And then affection. I call it the 6-minute hug, but beyond just kind of a quick hug or a high five or handshake, which has been really difficult for a lot of us during the COVID pandemic this past year. So just to kind of wrap up, the point of CBT is to identify our stressors and change the way we respond to stressors, and recognize how stressors affect and the role they play in the pain cycle, and how addressing them can improve the pain cycle, and then practice completing the stress response cycle by incorporating any of these things in your daily lives, right? Like if you're stressed out after a long day at work, don't go home and just watch Netflix. That's the tempting thing to do, but not necessarily a way we can complete the stress response cycle. This is a wide topic, and I'm more than happy if you are a patient here at the University of Utah to meet with you for individual sessions. It's part of my job. You can ask your university provider for a referral, and we can get that going. I meet with patients, sometimes for several sessions, sometimes just one or two. You can also contact me directly via MyChart, or you can ask a provider to route any MyChart message to me, and I'm happy to meet with you that way as well. So I think we are going to pause the recording now and